If you are worried you have Lyme disease, or just like the outdoors, and want the peace of mind of knowing whether you have Lyme disease or not, there is a new Lyme screening test based on decades of research by Dr. Richard Marconi, a professor at VCU Medical Center. For more information, visit glymedx.com. That's glymedx.com, or email at info@glymedx.com.
Infectious diseases, research, medicine, health. Welcome to Outbreak News Interviews. And now, broadcasting from the Outbreak News Skylar Studios in beautiful West Central Florida, here is your host, microbiologist and editor of OutbreakNewsToday.com, Robert Harriman.
Well, hey everybody, this is Robert here, and I appreciate you listening to the new interview I have today. And I encourage you to check out the website, OutbreakNewsToday.com. Now, since the Haiti cholera outbreak began in October 2010, months after the January 2010 earthquake, more than 800,000 cases have been reported, including about 9,500 deaths. Although the numbers have decreased dramatically over the years, the island nation still sees thousands of cases annually. Today, cholera outbreaks are reported in Kenya, Nigeria, the DRC, Tanzania, and most notably Yemen, where more than 360,000 suspected cases, including 1,800 plus deaths, have been reported in the past 3 months. Joining me now is Amesh Adalja, MD. Dr. Adalja is a senior associate with the Johns Hopkins Center for Health Security. Dr. Adalja, welcome to the show, sir.
Thanks for having me.
You bet. Now, while cholera is big news today with massive outbreaks in several countries, however, this disease is not new in the annals of epidemic history. Dr. Adalja, cholera does have a pretty significant historical record, doesn't it?
Yeah, definitely. Cholera is something that goes back thousands and thousands of years, that humans have been battling this infectious disease for quite a long time. You can even see references to it in Sanskrit texts, and there's a lot of famous infectious disease epidemiology that was worked out with cholera, with the famous John Snow map in England in the 1800s, where he discovered the source of a major outbreak in the Soho neighborhood of London, tied to a contaminated pump that really started the whole science of epidemiology. We've got Robert Koch, who's one of the heroes of infectious disease, battled cholera back then as well. And right now we're in the seventh pandemic of cholera, and these are seven pandemics that have happened basically starting in the early 1800s. And this is a disease that really captures the imagination. There's even a famous novel by Gabriel Garcia Marquez, Love in the Time of Cholera, that underscores how important this disease has been to human history.
Yeah. And how many people are affected by cholera annually across the globe today?
So those estimates are going to be somewhat fluid, because we don't necessarily get all of the cases reported to us. So when you see what's officially reported, that's often maybe the tip of the iceberg, because maybe cholera is not getting diagnosed. A lot of countries don't have incentives to report cholera because of the stigma associated with it. But the best estimates are there's at least 3 million cases of cholera every year, with close to 100,000 deaths per year.
Yeah. Now, cholera is caused by the bacterium Vibrio cholera. Where is this bacterium found, and how does someone contract it?
So the bacteria is found in kind of brackish water or coastal sea waters, often associated with zooplankton and certain organisms that live in those areas, and that's kind of its natural habitat. And the way humans get it is they basically step into this chain by eating or drinking contaminated water or food, although you can get it from being in contact with somebody that has it, because the bacteria is going to be shed in their stool as well. So that's usually how humans would contract cholera.
Now, most cases are probably considered mild, but the typical disease and symptoms of severe cholera are pretty recognizable. What are they?
Generally, with a person with cholera, they have very voluminous diarrhea that's watery in character. Sometimes they call it rice water stools, and they just have unrelenting diarrhea, and because of that diarrhea, they will lose electrolytes and fluids, so they may become very fatigued. They may become listless. They may become basically eventually comatose as their electrolytes and fluids are depleted, and they run into a state of severe dehydration. But it's the rice water stools, the watery diarrhea, that's really characteristic of this infectious disease.
Yeah, I remember when I was studying microbiology many years ago, one of the texts said that an individual with cholera loses their complete body weight in water in about 4 days. So,
right, and that's why it's so deadly.
Yeah. Okay, let me go to a word from our sponsor. For many years, we have been waiting for a Lyme disease test that actually works. After decades of research by Dr. Richard Marconi, a professor at the Medical Center of the Virginia Commonwealth University, a breakthrough test has been developed. The GLD test, recently launched by Global Lyme Diagnostics, is based on Dr. Marconi's science. For more information, visit glymedx.com, that's glymedx.com, or email them at info@glymedx.com. Okay, back to Dr. Adalja, and what about the diagnosis and treatment of cholera?
So the diagnosis in an outbreak setting may just be based on the history and physical exam and the characteristic rice water stools, but suppose you went to a hospital in the United States, what would they do? They would do a stool culture and try and isolate the organism in your stool. And the treatment is mostly just going to be fluid replacement, and that could be through IVs or it could be through oral rehydration therapy where you actually can drink this. And it's not just fluids, it's often it may be salt water as well as electrolytes and glucose in order to kind of replenish what you're losing. And there are protocols that are in place for that, but that's basically what it is. And in some cases, you do give an antibiotic, something like azithromycin that people may have heard of under the brand name Z-Pak or Zithromax. That can sometimes decrease the volume of diarrhea, but that's usually secondary. The biggest thing is getting these people rehydrated again.
Right. So let's talk about the situation in Yemen. This is the biggest outbreak right now, and it's chaos, to sum it up. Health and sanitation has been destroyed after 2 years of ongoing war and conflict. It's so bad that the World Health Organization decided not to send cholera vaccine to the region, essentially saying that it would have little use. Dr. Adalja, with the fighting going on, how do they possibly get a handle on this?
It's going to be extremely difficult. Cholera basically thrives in areas where there is little infrastructure, and right now that's basically a war zone. So it's not surprising that we have an outbreak of cholera, and I wouldn't be surprised if other infectious diseases also settle in there. And what we've seen basically is unrelenting, basically since October 2016, where there has been severe disruption in infrastructure. So things like plumbing, for example, don't really exist there. They have healthcare workers who are not being able to be paid. You have severe distrust in one faction of the government, another faction and another government. There is already pre-existing malnutrition, which we know makes this worse. So what they really have to do is get to the core of how you treat cholera, and that is setting up treatment centers where people can get intravenous fluids, where they can get oral rehydration. It's going to be very, very difficult, though, with that kind of ongoing fighting, because we're hearing about blockades there where aid can't get in. So it's basically a perfect storm for a disease like cholera to basically savagely kill that population and then basically become a fact of life, almost like what happened in Haiti. We're seeing Haiti was a natural disaster that precipitated it. Here we're seeing a human wartime type of disaster going on.
Yeah, and let me piggyback on the World Health Organization decision to at least temporarily not send the vaccine. That's the right decision, don't you think?
It's hard to say because there's a lot of logistics concerns. You have to remember this is a very resource-constrained operation, and we do have cholera stockpiles that are in place for these types of events. But we know that you have to really look and see what's the best value for the funds that you have, what's the best way that's going to minimize the amount of death and disability from this disease. And it seems to me that the WHO made a decision that the vaccine in this case wouldn't be the best way to actually handle this because there's such a shortage of infrastructure that if they could get IV fluid centers and oral rehydration centers, that may make the biggest impact. You have to remember that this vaccine is something that requires 2 doses to be protective, that there is a large number of cases and a large number at risk. Does the stockpile have enough to actually make that big of an impact? And can they transport the vaccine in such a way that with the cold chain that is required for these vaccines, there's a lot of logistics that go into it. It's not just an easy decision to make. So I assume that the World Health Organization really ran the numbers and realized that the biggest impact would be to scale up treatment centers for cholera rather than preventive vaccination.
Yeah.
But it's a very difficult decision, and things could change based on the numbers going on and what happens on the ground.
Sure. Well, sticking with the issue of the cholera vaccine, about a year ago, the FDA approved a cholera vaccine, and it was announced, I think it was yesterday, that the cholera vaccine, Vaxchora, I hope I said that right, is now available in the United States for travelers. 2 questions for you. What took so long to get this available, and how effective is it?
So it's interesting because we did have a cholera vaccine prior to Vaxchora. There was a vaccine that Wyeth Pharmaceuticals made. Wyeth, I think, eventually folded into another pharmaceutical company, I think into Pfizer. But because when I was a little child growing up, I went traveling and I got a Wyeth cholera vaccine. But that's no longer marketed. I think it had a poor market penetration in the United States, so Wyeth stopped making it. So it has been something that we haven't had for quite some time. You have to remember that it takes a long time to make a vaccine, probably about a decade, and it costs about $1 billion to bring something like this to market. So there isn't a very high profit margin on cholera vaccine, so there wasn't much of a demand. I think that because people are really understanding the impact of global health, you started to see companies get involved, and it's important to remember that even though there wasn't a U.S. licensed cholera vaccine for some time, there were others that were available in other countries that were being used, and it's just that there really had to be a company that was interested in making a vaccine, because cholera isn't a problem in the United States for people in the United States any longer. There maybe are a handful of cases every year. It's not a major deal, so there isn't a major market, so you have to price it in such a way that travelers would find it attractive and that there would be enough travelers to those areas. So there's a lot of calculation that went into it. But I think it's a great thing that we do have this cholera vaccine. And it is very effective. If you look at the studies, it really has strong efficacy data showing, and they even did human challenge studies with this vaccine. So basically 90% effectiveness at 10 days post-vaccine, and even 3 months past, if you read the FDA's prescribing information, about 79% efficacy. So it is a strong vaccine, and hopefully it will make an impact on those travelers from the United States that are going to cholera-ridden areas.
Yeah. Any advice to travelers to areas of the world that has cholera?
Well, if you can get vaccinated before you go, that would be one of the most important things that you can do to protect yourself. And then the other is to really be meticulous about the food and water and contacts that you have. And it can be very difficult. This is a disease that can spread very rapidly, and at any sign of this type of diarrhea, you need to seek medical attention so that you do not get behind on your fluids. But I really think, hopefully people will be getting vaccinated if they're going to those areas now that the vaccine is available.
Okay. Any final thoughts or anything I left out that you want to talk about?
It's really important to realize that this outbreak in Yemen is something that would totally be expected, because cholera is a disease that thrives in poor infrastructure. It just takes a very small amount of infrastructure to stop cholera from infecting people. Remember that there were cases in Mexico several years ago, and it stopped very quickly in Mexico. Mm-hmm. And people don't necessarily associate Mexico with good infrastructure. So cholera is a disease of war, poverty, famine, and lack of basic health infrastructure. So once that is dealt with, you'll see cholera cases evaporate.
Yeah. Well, thank you very much, Dr. Amesh Adalja, for your time and expertise, sir. I appreciate it.
Thanks for having me.